Let's get this started. Hello, welcome to the webinar on the COVID-19 impact on substance use, calling it Depression and Substance Abuse, COVID-19 Impact. I'm Mike Palladini, a pharmacist educator, and I work in the field of substance use, substance abuse, by educating primary care physicians on the use of substances, particularly opioids, and other drugs and proper prescribing methods and strategies, where we discuss with physicians on how to better prescribe and minimize chances of substance abuse. So in preparing for this webinar, I've been meeting with physicians throughout the area. I live and work in the Southwest Pennsylvania area near Pittsburgh, and I have had several discussions as of late that have revealed to me through doctors that the anxiety and depression and overall mental health status of many patients has been on the increase. Reports of anxiety over all of the conditions and symptoms of COVID impact that we will talk about during this webinar have become very apparent over the months since this all began, and firsthand experience through doctors meeting with patients has led me to believe, and the data that we're going to present here as well supports it, that the impact of COVID has been very significant on a number of patients, older and younger as well. So that being said, let's see if we can get the slides moving in the right direction here. Okay. What do we want to accomplish through this this webinar? Well, the objectives are to identify certain signs and symptoms that are related to and symptomatic of depression, and then subsequent use of substances, drugs as coping mechanisms. So alcohol, various substances that are available, marijuana use, opioid use, stimulant use, as coping mechanisms for people who are prone to utilize these types of substances as coping mechanisms to deal with ongoing anxiety or stress or depression that sets in, and then to look at how prevalent this might be, increasing in people seeking treatment due to certain substance use, increasing or worsening, or people relapsing, all leading to exacerbation of mental health issues that we want to discuss. So there's been a lot of articles out there. There's been talk, speculation that isolation and just stress and grief and uncertainty that's happening globally for people is truly happening. So is there any data that can support that? And really now we're starting to see numbers that certainly indicate that, with specific surveys and numbers supporting the unfortunate results. Any infectious disease outbreak, historically, the SARS outbreak of years ago, and now the current COVID-19, these outbreaks can cause fear and worry about our own health, protecting ourselves, the health of loved ones, the infectiousness and contagiousness of this disease, the uncertainty, the symptoms, all of that leads to a lot of fear and worry about our own health. That can lead to symptoms of sleep, insomnia, changes in sleep patterns, changes in eating patterns that can affect one's health. Concentration, sleeping overall can suffer. Chronic health problems that may be controlled or partly controlled can worsen. Lack of access to physicians fear of going to the doctor, fear of going to the emergency department and not being seen can all lead to a worsening of the health conditions as well as the exacerbation of mental health conditions. And subsequently, we're starting to see increased use of alcohol, increased use of tobacco as stress relieving coping skills. And then, of course, other drugs that become available. So common signs to look for of what we call stress and distress. As we mentioned, feelings of fear, anger, people can feel that things are unfair, sadness for fate of others alongside grief, ongoing worry because of uncertainty, numbness. I mean, we all get so weary of it and want to just say, let's not worry about it anymore. Let's just move on. Frustration as to what do we do? What kind of direction are we getting from authorities or from people that we know? A lot of mixed signals out there. So it can all be very, very frustrating and lead to more concern and worry. Appetite, energy, activity levels all are affected and can lead to unhealthy consequences. Decision-making skills, again, concentration, sleeping, nightmare scenarios all are occurring. Headaches, body pain, stomach problems, rashes, all physical reactions that people have to stress due to the stress-related mechanisms within the body. Again, worsening of chronic health problems and increased use of substances. So some numbers that have been compiled over the ensuing months have led to some statistics for us to look at. When polled, and a lot of this data, I didn't cite it on the slides, but much of the data that has been out there for me to share with you has come from the CDC and other federal agencies. The first bullet point there, say 53% or half of all adults in the United States surveyed reported that their mental health has been negatively impacted due to worry and stress over the coronavirus. 1 out of every 2 people will admit that they have been stressing and worrying about this pandemic. 36% report difficulty sleeping, 32% difficulty eating, 12% report increase in alcohol consumption or substance use and worsening chronic conditions. So as far as alcohol consumption and substance use goes, that's a doubling of the amount that would really report or normally report on using substances or alcohol consumption pre-pandemic times. Isolation and job loss, situations like that people are experiencing that then lead to increased stress and subsequent poor mental health outcomes, such as an anxiety diagnosis or a depression diagnosis. If someone has a borderline type of bipolar disorder that may have been controlled somewhat, the COVID-19 impact has worsened this and caused individuals to seek additional treatment because they feel lack of control. Job loss, economic struggling is associated with increased depression, anxiety and distress, low self-esteem. All of this can lead to higher rates of substance use, as well as we're seeing increases in suicide numbers. I've known people personally that initially were becoming acclimated to the job loss, feeling that that was happening to a lot of people. And as time went by and assistance started to wane, support started to wane, the uncertainty with how long this would take began to impact individuals and cause increased stress that then, out of boredom, out of fear, out of worry, the coping mechanisms that usually include substance use started to increase. And again, personally, I've known several individuals that have succumbed and couldn't handle it. And there's suicide reports and suicide numbers increasing. So people are feeling desperate when things do not seem to be improving for them. Frontline workers, poor mental health due to burnout causes increased anxiety or mental illness, as well as those that may have poor physical health. So there's a lot of concern for the people that are frontline workers taking care of these individuals day after day after day and really needing some relief and not seeing anything. I've worked with individuals in this area who their job was to treat and address anxiety for 911 workers who they would get these calls on a continuous basis. And then you have to consider, well, who's helping these individuals deal with the sorrow and the suffering that they're seeing? So it's a real concern, and we're starting to see mental health issues on the uprise, on the uptick with frontline workers. So some numbers here again from the CDC prior to the pandemic in the spring, early spring. Polls show that nearly 1 in 5 adults, approximately 47 million, have reported having a mental illness in the past year. So 1 out of 5 US adults have some diagnosis reported of having related to a mental condition. In 2018, again, pre-pandemic, 48,000 Americans died by suicide. So there are considerable factors that lead to these high numbers already in the United States, in our society, that have only been exacerbated by the stressors caused by COVID. Deaths due to drug overdose have increased in approximately the past 20 years, more than threefold, from 6 deaths per 100,000 to 20 in 2018. So we have seen drug overdose for a variety of reasons, and that's beyond what we want to talk to today. But overdose deaths have been on the rise now for nearly the past 20 years. So again, we're starting to see in this pandemic period an increase in overdoses. At 2018, we finally started to see nationally a leveling off of that number, mainly because of opioid-related deaths. Synthetic drugs were starting to become more of a culprit, the drug supply, and now we are seeing increases in drug supply of synthetic drugs because of the COVID pandemic affecting regular routes of distribution. So we are seeing odd drugs, new synthetic drugs entering the supply, people getting desperate for some type of substance, so they will get careless and try newer drugs. And we are seeing these folks succumb to overdoses. So overdose numbers are on the rise as well. So this slide from the Kaiser Family Foundation measured symptoms of anxiety, depression, and both in May, June, and July of 2020. And as you can see here, there's been increases month to month on each of these, with the bar on the far right, the darker bar being the combined anxiety and depression. And average numbers, 40% of individuals surveyed are expressing that yes, they have experienced symptoms of anxiety and or depression recently, the past, what says down here, maybe the past month or so. So we are seeing increases as time goes by. That's the last tabulated data that we can look at this point. So that mid-July tracking poll that we just looked at found other reasons why the COVID-19 impact is causing some of these concerns. And among those reasons, parents are concerned about their children. And many discussions I've had, and nationally, concerns and discussions among communities has been how to address the issue of schooling and children attending school. And are we prepared to have virtual or remote schooling that would be substantial for children? And as you can see here, 2 out of 3 parents said they are worried that their children will fall behind both socially and emotionally, and not listed here, but perhaps academically as well. So the concern is that our system is not set up. Individuals at home do not have the means to get the school experience that they normally would have. And with these school closures and childcare centers closing as well, it's disrupting to parents their ability to work. They need, they need to make plans that accommodates for their children. So their daily routines are disrupted, and causes other turmoil emotionally, maybe financially and economically as well. So the issues with children attending schools and our society coming to terms with that is another source of concern, stress, and distress for parents. So the CARES Act, which came out in the spring as relief for this, allocated money for the need for mental health and substance use services. So federal money ends up in state grants that then gets into different communities to fund and extend and expand mental health and substance use services, as we are getting reports that more and more people are coming forward and looking for these types of services. You can see some of the numbers there: 425 million by SAMHSA, which is the federal substance abuse mental health agency, for expanding coverage. And a huge area that I mentioned here is the availability of telehealth and remote care for people, and getting those paid for by these insurances and federally funded programs. So that was a quick turnaround by insurance agencies, by the industry, by the government, to allow telehealth to serve as the health medium for those services to be reimbursed by providers, and to make it easy for people to remain in touch with their healthcare providers and continue to get prescriptions ordered, symptoms addressed, their care to be held up to date by providers, and allow people to see their doctors and nurses. And again, at the bottom there, veterans are taking advantage of telehealth services as well, to make sure that veterans don't become isolated. The incidence of mental health, PTSD, suicide is very high among veterans in this country. So that's something that needed addressed immediately to make sure that that did not happen. Okay. So during late June, just another way to look at some of the things we've been expressing here, 40% of U.S. adults reported struggling with mental health or substance abuse. And you can see a breakdown there. So if someone were to have called and made a survey of individuals, they would ask questions and then determine that, yes, in the past month, past 30 days, 1 out of 3 people stated that, yeah, I've had some anxiety or depression symptoms, and 26% having stress or trauma related symptoms, and then started or increased substance abuse. As I mentioned earlier, 12%, this report is saying 13%, excuse me, and an 11% response of a serious consideration of suicide. So these are big numbers that are being reported, where nearly 1 out of every 3 individuals are expressing some type of anxiety over coping with the whole pandemic. So some other statistics here for you, or thoughts on suicide ideation. When we have more mental health conditions, elevated levels of substance use, we will see more suicidal ideation. And this is being reported as the previous slide just spelled out. The prevalence of symptoms of anxiety disorder was approximately 3 times those reported in the previous quarter in 2019. So 25% versus 8%. Anxiety disorder has increased by threefold. So when I am having a discussion with a physician and I ask them, are you seeing more people complaining of anxiety? And their immediate answer is, oh, yes. When it's 3 times as many people who are experiencing that, then that is fairly obvious. And healthcare professionals are seeing this without a doubt. And depressive disorder, 4 times greater than the second quarter of 2019, a full 24.3% again versus 6.5%. So other recent surveys that we've compiled here and that I can share with you regarding drug and alcohol use. Many respondents displayed higher rates of use. 55% report an increase in past month alcohol consumption, with 18% reporting a significant increase. So that's again, a significant reporting number. Over half report an increase in consumption. And we would have to ask ourselves, what is going on here? Is it over boredom? Is it over stress? Is it over worry? Are we looking for more to do? Are we stuck at home? Too much on our minds, overwhelmed, fear, concern, worry, all of that. And one of them very popular coping mechanisms in our society is to drink alcohol to relax. 36% report an increase in illicit drug use. So we're seeing higher prevalence of use where normal routine use for those who are using illicitly has been increased significantly by 36%. Initially in the Northeast states, they were reporting that 67% had an increase in past month alcohol consumption. You'll have to pardon my guest here, but he's not bothering me too much, so hopefully that'll be okay. Significant increases in alcohol consumption initially, so there was quite a bit of uncertainty and concern. And remember, the death rates were rather high at first, so people were feeling very anxious about this. And one of the methods that we can look at to show that that was certainly occurring is the amount of alcohol consumption. I can recall services that were delivering alcohol, states making allowances in their legal framework to allow for alcohol delivery to individuals, fully knowing that alcohol was a major coping mechanism for a majority of people. The last bullet point, participants were asked why they were prompted to use substances within that month. And there's the answers we see: cope stress, relieve boredom, cope with mental health symptoms such as anxiety or depression, which may have been existent in the first place, or maybe something new that somebody was experiencing. But a worsening of anxiety or depression was then tried to be relieved with alcohol. And a lot of people will also use drugs and medications to do that as well. So a lot has been put in place. Therapists, agencies that work with those who suffer from mental health on how to reduce stress. What tips are there out there to help us reduce stress? And here is a summary list from a federal website that kind of spells out some simple things that are suggested that we don't overlook and take for granted, but that we certainly should adhere to. Setting limits, strict time constraints for work or school. Don't blend that time into family time. A lot more people are at home with family, trying to make the best of those times. It's something they're not used to doing, and working and learning how to define these boundaries and make them work appropriately. Limit exposure to social media and reporting. A lot of news out there, a lot of varying opinions, a lot of doom and gloom. So we need to set a specific time and don't overwhelm or inundate yourself, as that adds to stress. Free and accessible online webinars. There's a lot of videos out there that incorporate exercise, meditation. Learn something about that. Learn more about healthy living and learn how to incorporate that into your daily life. Videos on how to meditate for 5 minutes in the morning, how to do a few stretches, a few exercises, how to start your day on a positive note, 30 minutes of walking several times a week. Stay hydrated. Don't snack much. People work from home, a little less strictness on their access to the kitchen. Stressors, again, a lot of people can eat because of it, gain a few pounds. Next thing you know, that's starting to concern someone. So it can kind of snowball on how we take care of ourselves when we're not in a routine that we're used to. Dinner time for family, and then some of the rules that go around there include family members, openness, talking. Everyone's worried. Let's not try to hide things. Let's be transparent and open out there. And then finally, new hobbies, more time at home, time to be creative, start something that you never had the time to do. A lot of people feel uncomfortable with having too much time on their hands, always used to going and running and being productive and feeling that they're not making the best use of their time. So a recreational activity or something that can be craft or creative may help and go a long way. So if we look at a patient health questionnaire that's been utilized, that's within the mental health community on general anxiety disorder. Straightforward question to people who were surveyed: how often in the past 7 days have you felt nervous, anxious, or on edge? Have not been able to stop or control the worrying, felt down, depressed, or hopeless, or felt little interest or pleasure in doing things. So this is a standard questionnaire, and numbers on how often in the past week have you felt that. So if you're listening to this, or this is something that you can ask yourself and say, okay, how have I felt this past week? Or any incidents of these 4 points here, and how often is that happening? And across survey periods, several surveys, an average of 36% of respondents nationwide reported, yeah, they have experienced these symptoms at least once in the past 7 days. Last year at this time, when the survey was done as part of a nationwide survey for GAD, generalized anxiety disorder, that rate was about 11%. So we're doing these surveys now with more of a purpose, but to make that comparison make sense, for people who do become part of the mental health system or as just part of general care, these types of surveys are conducted routinely. So we have something to compare to, and we can see a 3-fold increase again. So after all these numbers I've been putting up here and what we've been going through, I think we can fairly say that incidents of anxiety and depression are tripled since the beginning of this pandemic in our population, and that is truly significant. So when this all began, there was a lot of discussion among the mental health professional community, and psychiatrists and psychological groups expected to see these symptoms because of what they're calling here in quotes, the cumulative impact of isolation. And we saw that come out initially with nursing home residents who were quarantined, weren't able to see their family members, upset they couldn't see their loved ones, their parents. What was this isolation going to do? People were afraid of the contagiousness and were then quarantined themselves voluntarily, haven't gone and done the things they want to do, find themselves at home and alone much, much more than they're used to, than they have in the past. So we've had quarantine measures that have affected people. Access to faith community. Many churches stopped having services until they found out ways to do them remotely. And then, the word got out that people can join that way, and became more of a routine in their day, tune in on this day on this channel and see your church with their broadcast, which approaches the the experience of being in church and having access to your faith, but it still comes up short when we talk about full access and being immersed in the community. Social support, seeing people, being out, meeting neighbors, all of that has been reduced. And then when there's economic loss, stress over jobs, stress over money, that can layer, as they say, the stress and anxiety on top of the other isolating principles. So it becomes an overwhelming impact, to say the least. So this statement here, loneliness and isolation was cited the most by people who are experiencing severe depression and anxiety. And then some of the examples are listed there. Someone may have a loved one who's sick, may have COVID or another, may not be able to see them. There's guilt. People are missed. People miss the normal, quote, normal times. Kids are out of school learning remotely. They are not in their social environment and learning in that respect. Childcare is not available. People are working from home, working less. They have lost their job. A lot of uncertainty. Again, I keep using that word, but that is one of the driving, impactful issues, is the uncertainty of how long can this be maintained? When's the end in sight? When will we be back to work? When will we normalize the work? Will there be work? All of these affect people and cause anxiety. And again, the organization has to be there. It can be overwhelming. Kids at home, smaller kids at home, no childcare. School can be an issue. Someone may be sick, can't visit them. All the isolating and anxiety producing situations. So there's an acronym that's been developed that has helped people to manage stress. So SCOOP, SCOOP, stay connected to family and friends. So as much as possible. I know I have family members who live in other states, and I've made a point to send more emails, pictures, texts, say hello, anything to keep the connection up. Platforms now with Zoom, some families are able to do that and see each other's face, have birthday parties that way. Anything to get through a day and not completely miss an event, make an attempt to remain connected. Compassion for yourself and others. Understand that a lot of people are going through things. A lot of people are suffering and feeling what you may be feeling, and it's okay to feel this sadness, and again, feel that compassion for others and that all in it together feeling, and try to stay connected and maintain that compassion for everyone. Observe your use of substances. So if you do like to have a drink or here and there, there's a lot of cannabis or marijuana use with legality and medical marijuana now. That's available to a lot of people. People have prescription drugs that they use for the anxiety. Maintain the prescribed amounts. And if you feel that that's not working, the other O, it's okay to ask for help. If you feel that you're not handling it well, or the anxiety is keeping you up at night and it's not improving, reach out, stay connected. Family, friends, physicians, and support groups, all of that is out there for help. And physical activity to improve mood. Daily walks, stretching, doing some exercises, anything to get the blood moving, and has been shown to help with mood, with stiffness, with pain issues. All of that can be improved with some physical activity. So SCOOP. The CDC survey, again, data reported 41% of respondents are struggling with mental health. Nearly 41% report mental health conditions, substance use, depression, suicidal thoughts. Number of Americans reporting anxiety symptoms, 3 times the number as last year. I think I kind of said that earlier. So this is basically a summary slide of the numbers and what we've been talking about. So 3 times the increased incidence, and then high numbers, nearly half the people being asked are reporting issues, mental health issues and substance use. So if we go a little bit further on some of these surveys and asking individuals, what substances are being used since the beginning of the pandemic? And you can see the numbers now. Started using the following substances. So alcohol at the top. Whoops, I don't know why that happened. I'm sorry. And you can see other cigarettes, stimulants, opioids, cannabis, and e-cigarettes. That the most common substances that that are used are being used at these rates. So when we look at these results, we can say the preliminary evidence that COVID-19 related worry and fear may put people at risk for initiation of substance use because of COVID. So for using substances as coping skills, as the last part of this says, that might provide critical information for helping individuals. So we need to know, what are they doing? If more alcohol is being used, would an individual need to talk to somebody to see if it's becoming problematic? Should they reach out to a support group, say an AA group, and have an online type of relationship there that can help them? All of this can come into play when we start deciding on how to address the increased numbers associated with substance use. So I was able to attend a town hall meeting virtually recently, and it was made up of people in recovery from substance use, as well as individuals who run some certain agencies or are part of a community. And it was a roundtable discussion. And some of the highlights that came out of this were worth noting, and I put them in here for you to see. So everybody was coming up with different sayings, but overall, several participants wanted people to remember that this is a human issue, that people are hurting. So I think we were still in the midst of an election time and a lot of political talk and the economy and a lot of those things, and discussions and topics can kind of get a little away from us. But it comes down to the fact that these are people, and a lot of people are hurting and suffering because of this. So based on all the things we just reviewed, that's how humans react. That's what are happening to people to cope with the stress. And it certainly is a human issue. Normalcy. What is normalcy? Can we even remember that? Will we return to that? And how long will it take? Again, that uncertainty. So in the meantime, how do we make what's going on now our normal? How do we best minimize these abnormal effects that are happening to people? There are community efforts that are in place that have been going on for quite a while that get resources from available places and then help distribute it. Money, housing, food. We've seen food lines and food drives, all kinds of goods, people putting together Corona kits for families that are there on a daily basis where individuals can come. So we really need to see communities coming together and help one another. A lot of concern about kids and school problems, and additionally a reduction in access to social services. A lot of children who go to school go to after school services or get free meals through school or other types of services where they can see professionals, and all of that has been reduced. And if they're stuck at home, They don't have access to these important individuals in their lives. For people in recovery and maintaining that situation, the issue is too much solitude. You know, solitude is an enemy of recovery. We need connection. So more networking needs to be done. As I show on this bullet point there, NA meetings, AA meetings using Zoom, see faces, hear people, express yourself. Churches, organizations coming forward because mental health providers are very busy. So there's help needed all around. So it truly is a community effort. And then listed there at the bottom, issues with senior citizens. Look in on people, make sure they're okay. They may be alone and they may not have as many people to help them. And the isolation may really be starting to prey on them more so than others. Have structure in your life. Many people cope by having a structure that they can rely on, something that they can control, and putting exercise and eating right into it to inject some health conscious efforts into a structured daily life where it's independent of all the uncertainty going on out there. So economic issues, a lot of job loss, and that fear of losing job is a major concern. People who already have a mental illness condition, mental health concerns, that additional fear of losing a job can really put one over the edge and cause a full-blown anxiety attack or depression to set in. With high rates of unemployment, major concern around mental health workers, how this will impact depression and suicide rates. So we're starting to see increases in both of those as we've looked at. So that despondent, helpless feeling, especially with employment and a self-worth, can really lend to that suicidal ideation that we have to be truly concerned about. People are more likely to die of suicide if they've also experienced substance abuse, intoxication, medical illness, stress, firearm access, or suffered recent tragedy or loss. And we can throw job loss as traumatic or tragic in there as well. So various factors that come into play that can really combine to cause a very tragic situation. When people do have suicidal ideation or thoughts, drug use can create the mental highs and lows that we call it, worse than that. So ups and downs of drug use, the false highs and then the deep lows, that can then lead someone to act upon those suicidal thoughts. So if everything seems to be very helpless, very anxiety producing and depressed, and one uses certain types of drugs to alleviate that stress, which is temporary. And then when the drug effect wanes and someone dips down into that depression, that post-use depression, that's when they're at high risk to act on those suicidal thoughts. And then more than 1 in 3 people, so over 33% of people who do die from suicide, are under the influence of alcohol at the time of death. So that really clouds their thinking process and allows them to act on those fears. So we've already talked about the 41% adverse mental health in June. Again, just as kind of a summary slide again, 3 to 4 times higher now. 11% have reported seriously considering suicide, and overdoses have increased 20% compared with the same time period in 2019. So what is our healthcare response? What is going on? What can we do? We've had some tips about relieving stress. We've discussed telehealth and the prevalence of that modality taking place. So we're trying to address this. Public health specialists have been working on it with policies, with insurance companies. States have eased restrictions for telehealth, makes it easier to access a medical provider, and easier to prescribe medications all around, as well as for people who have opiate use disorder, which traditionally always 100% of the time required an in-person visit. So we're not allowing people who have substance use disorders, i.e. opiate use disorder, to fall out of treatment and get into a risky situation. So then we have to look at some long-term considerations. Say an individual is suffering some grief. We have to make sure, due to the passing of a loved one, we have to make sure that we're able to address the normal grief response, and that does not turn into a prolonged grief that can morph into a major depressive disorder, or what we can call even some PTSD. So there's a lot of grieving, and it may get worse if more people pass due to this pandemic. So we need to be able to reach out and have these grief resolving processes in place to address people's needs. So prolonged grief disorder is 6 months of intense longing, preoccupation, emotional pain, and loneliness, that all listed there. Increased suicide risk. So the isolation and the lack of communication and connectedness between individuals can turn this grief process into a prolonged disorder, and then all of those consequences with it. If this becomes established, it can become chronic, which can then include comorbidities such as substance use disorder. So the coping with the pain and the depression is usually with alcohol, with the drugs. So these are the kind of things we'll have to keep eyes on for individuals, that they don't resort to these types of coping mechanisms that are very risky and consequential. So the CDC recommends making a plan if you live in a so-called unsafe home. Self-care, maintain social connections with people outside your immediate home. So social connections virtually, if need be now, is the suggestion. Include economic support, reduce stress. Stress is related to discrimination, promoting community social connections, and of course, watching out for those who are at risk of suicide. And knowing who those are is educating on what causes that suicide risk to increase. And that is the kind of culmination of everything we've been talking about. So I think this is our final slide here on how we can look out for others, and how the mental health community and the medical community overall can address some of these anxiety, depression, grief, PTSD scenarios, and prevent the unhealthy coping mechanisms of substance abuse, and then leading to an increased risk of suicide. So we can do screening, so we can prevent normal grief and distress from becoming prolonged and disordered. And then we can do an assessment. So we need to maintain contact with individuals who may be at risk, and then find the appropriate treatment for them. That includes specialty mental health treatment with those at higher risk for chronic problems, dangerous behaviors, significant mental health, substance abuse, recognizing who these individuals are, recognizing the symptoms that we've talked about, maintaining connection, and then ultimately being able to get individuals in contact with those that can help them. So steps to help with coping. Very basic format here. This is from the CDC, and I added this at the very end as, you know, some basic things that we can keep in mind on a day-to-day basis. Take care of your body, be it exercise, eating well, mindfulness, connect with others. Don't let relationships fall. This is the time to increase connection with others. Send that text message, call somebody. Find out if you can use a platform that allows you to have virtual meetings, emails, humor, send jokes, send funny stuff, all to keep things with some sense of normalcy as well as maintaining those connections. Take breaks from everything. Don't work too hard. Take a walk, take a breather, relax, talk to some family members. Stay informed, but avoid too much media exposure. Again, take a break, as the other bullet point says. And if needed, seek help. Do not be afraid to reach out. Processes and the framework has been put in place for people to easily connect with someone who could understand what they're going through and then help them navigate, what the next step can be, and remind them of some of the healthy coping mechanisms, and just to let them know that they are not alone in all of this. So that's the final slide. Thank you very much for listening. I hope it helps with moving forward in all of this. Stay safe, and everybody please take care.